Hi, everyone. Thank you for coming today. My name is Megan. I'm a family nurse practitioner, and I'm educated in conventional and integrative functional medicine. My specialty is women hormone health and also metabolism health and weight loss. So I'm going to share my screen with you. That way we can continue in our webinar. Just to making sure the webinar is not HIPAA compliant. Everybody can hear you. And if you have any concerns that you don't want anybody to know, please do not share here. However, if the question comes up, you're welcome to put it in the chat box and I will answer after the webinar. So fighting fit after 40, it's real. Why losing belly fat after 40 is hard? Let's get into it. A little disclaimer, this information, including but not limited to text, graphic, images, and other material contained on this PowerPoint are informational purpose only. The purpose of this webinar is to promote broad consumer understanding and knowledge of various health topics. It is not intended to be substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physicians or other qualified healthcare provider with any question you may have regarding medical conditions or treatment and before undertaking any new healthcare regimen. And never disregard professional medical advice or delay in seeking it because of something you have read on this website or webinar. No guarantee is provided or implied. Results may vary based on each patient's physical health and adherence to the care plan. So designed by the doctor, this statement have not been evaluated by United States Food and Drug Administration. These products are not intended to diagnose, treat, prevent, or cure any disease. Now we got the disclaimer out of the way. Who am I? I'm a daughter, I'm a sister, I'm a wife, I'm a mother, and I'm a nurse, and I'm a nurse practitioner. During my experience at nursing at the hospital, different floors, different units, I learned a lot. I saw a lot of devastated people after a stroke, after cancer, after having surgeries, and how they having diabetes, getting their legs cut, and all of this. It just got me thinking like, okay, I wanted to be a nurse to help these people. But when I became a nurse practitioner, I found that I was working at internal medicine, and I find out that I'm increasing the dosage of the medication. I'm putting them in different medication. I tell them go diet and exercise, and still they're coming back with the same problem as I was going back with the same problem to my doctor. So my history at age 28, I was diagnosed with ovarian cancer. And I was under so much stress from moving to this country with two little boys and my husband, learning English, learning culture, finding job, didn't have enough money. Anyway, so the stress was high. And I was diagnosed with ovarian cancer. Now I have to go through that. So of course, conventional medicine did perfectly and helped me to cure my cancer. After 5 years, I continue in my lifestyle that I knew with high stress, eating junk, and now not sleeping at night because I was working as a night shift nurse practitioner, nurse assistant, and two kids. Anyway, I developed colon cancer. So they found the polyps, they removed it, and they rescued me from cancer again. However, I continue with what I was doing, and with the history of PCOS that I have, which you don't know if you know, is polycystic ovarian syndrome and mostly insulin resistance. It is a syndrome, means a lot of other problems goes together. So it's the bundle of the issues that goes together with PCOS. and my detox pathway was broken. So I was going back to doctor telling them about I have muscle pain, I have migraine, I can't sleep, I have joint pain, I have my back hurts, I'm gaining weight, I feel tired, I have constipation, and they were just giving me medication for all of this. Go take that for depression, go take that for anxiety, go that for sleep, for migraine. And I was just showing the side effect because my body wasn't ready for all this chemical to put in on top of all the stress that was already in. So I was showing a lot of symptoms and my body didn't like it. So until I become a nurse practitioner at internal medicine, as I told you, and then I find out, okay, something is causing us to be sick. But the more I looked into, the more I found out is inflammation. Our body reaction to what it comes to it and how the inflammation is trying to protect itself and heal itself. And that is causing more damage and more tissue destructions in our body. Then I went back to school and studied intermediate functional medicine, and I found out how our body functions, what it needed to heal. And I start implementing it to myself and my patients. And I say, yeah, the weight is going down, we feel better, blood pressure is regulating, blood sugar is regulating, and things are getting better. So that is the way I learned integrative medicine, and I've been practicing this now over 9 years. And I learned a lot. I've been treating a lot of patients and mostly women. And I have so much passion because I can heal people. I can help them to prevent chronic disease and help them to be happier and healthier and enjoy their life. This is me. So when I was 35, I felt like 50. I was sick. I was tired. And now at age 49, I feel like 20. I work 2 jobs. I have my own business. I still go to gym and exercise daily, every other day or 4 days a week. And I feel good. So this is me, and I love my life now. If you would like to schedule a 15 minutes call with me, you're welcome to do that after this presentation or now. And then you can visit my website also here. So the objective that we will cover will be biological aging and hormonal shifts, metabolism changes and muscle loss, inflammation and gut health, and how can we find out about the problems by testing advanced labs and also integrative strategies and also case-based protocol design that we used. So hormonal decline. After age 40, we missing estrogen, we're missing progesterone, we're missing testosterone, and our hormones are declining. And that is causing our body to react. See, hormones, they have to be active in our tissues. So if we are, so how we become menopause is we are having joint pain, we're having hair loss, we're having brain fog, we're having we can't sleep at night, we're becoming anxious or depressed, our gain increases, our vaginal dryness comes, and with men will be erectile dysfunction. So all of this is coming with hormonal imbalance. Now, we live until we're 80 and 90, but from age 50 and above, we're kind of miserable. We're dealing with all the symptoms that we don't have answer for, which if we just replace those hormones, we can help our body to continue feeling young. So it is important to find out what hormone is causing those fat within the organ accumulations and inflammation in our body. Cortisol is our stress hormone. So anytime we are under stress, internally or externally, it causes cortisol release. Cortisol release demands sugar. With sugar comes insulin release, and then cells become insulin resistance, and then too much sugar in the body turns to the fat. All of this is kind of the cascade is going day by day, every day. Now, where the stress is coming is from our lifestyle, is from family, from job, our body feeling inflamed and sick, imbalance of the hormone, too much toxic exposure in our body, not getting nutrients, and food, enough nutrients and things that our body needs to function. And all of this is causing a stress and cortisol release in our body, which that causes the fat accumulation around our organs. So we're going to get to that. Thyroid downregulation. So anytime we are under so much stress, thyroid has to compensate for the adrenal gland, which is releasing cortisol. And thyroid gets inflamed and also the tissue gets damaged. Now it becomes hypoactive. So most of the women after age 40, they are diagnosed with hypothyroidism. And the reason is they're under so much stress and they're eating junk or their sugar is not regulated and thyroid has to work harder. And finally, from all the inflammation, it becomes hypoactive. Now, we also have hyperactive thyroidism, but most of the people, they become hypothyroidism. So we put them on levothyroxine, but if we don't put them on T3, which is other kind of medication for thyroid. And sometimes I use as peptide, which is biregulator to help with thyroid cells health. And the test that I run is comprehensive to find out early if thyroid is getting hit or not. So if thyroid antibody is high, that means there is inflammation in the thyroid and thyroid tissue is getting destroyed. And we need to stop that before disease happens. So we are here to find the underlying cause, find the early signs of the developing disease and prevent that to make sure we don't get hypothyroidism, we don't get cancer, we don't get dementia, we don't get cardiovascular problem, we don't get diabetes. So we're here to prevent that. And insulin resistance, when we have too much stress, we eat high carb food, we don't exercise, we don't have enough muscle. So the insulin, the cells, which the insulin is a key, has to go inside the cell and open it up for the sugar to get in. That get rusty, and then it become resistant to too much insulin. And then the sugar can't get. So now we have too many insulins and sugars in the blood. So body tries to put those sugars, kind of package them as a fat or large molecule of sugar in organs such as liver and around our organs. And then also insulin is there, so doesn't know where to go. It demands more sugar. So the craving of the sugar comes from here most of the time. And then that causes inflammation in our body. That causes the destruction in our body. And we need to making sure we help our body to heal and not deal with too much insulin and sugar all the time. Muscle mass is really important. Men has more muscle mass than women. They can take more calorie in than women, but we need to make sure we exercise to build those muscle, and we wanted to make sure we have enough proteins, creatine, and CoQ10 and things before going to the exercise, at least half an hour or half an hour after exercise, to make sure our body has those proteins and sugar and things to burn and use to build that muscle, and not go and tap on the muscle and bone, which is already our body is under stress and cause more stress on the body and more inflammation and more destructions. So it is really important that we have enough muscle mass that causes us to be metabolically active and reduce the body metabolism rate. So the less muscle, less calorie burn. Microbiome or belly fat are really important. So if we have our gut cells are like one layer of cells with junction connected to each other. If the cells in the gut is inflamed, is broken, we are not observing nutrients to that cell. We are not digesting our food very well. We don't have a healthy microbiome. We have too much of the bad bacteria or fungus or candida. And then the junction is broken. So the waste of the bacteria, the waste of the food, the waste of the microbiome, they get to the bloodstream. And blood sends all the army in white blood cells to fight it off. And that causes systematic inflammation. So we want to prevent that as much as we can by having a healthy gut, to making sure what we eat get observed, get digested and observed, and change chemically and become to the product that our body uses. So sometimes people are like, yeah, I'm eating enough protein, but also they take acid reflux medication. So they don't have enough acid in their stomach to break down this large protein to a small amount of the amino acid and for better digestion of the protein. So that protein doesn't get absorbed very well. So we need to look into the gut health and ask questions and then heal the gut cells to making sure, for example, gut causes GABA production, and GABA is the neurotransmitter and precursor for progesterone. So if we don't have enough GABA, is not making enough progesterone, we feel anxious, we feel tired, we can't sleep at night. So it is really important that we we making sure we get enough of we have a healthy gut cells first and microbiome. Second, we support the body either with progesterone or GABA or other things to help it to make sure it doesn't get rattled. So we can find out about the gut health by using the advanced stool testing and find out how much inflammation is on the gut, which is the molecule that the test we can do, which is zollinen, and then find out how much inflammation is on the gut. So we can test for DEXA, which is DEXA scan showing us the visceral fat around our organs. But also we can use those weight scales that we can hold, and it tells us how much muscle mass we have, how much fat mass we have, bone mass, and then metabolisms and things that we can monitor. Like, for example, people who are on GLP-1, such as Ozempic, Zepbound, Mounjaro, or other GLP-1 weight loss medication, we have to make sure they don't lose the muscle that they need and they lose the fat. So this is the one way we can monitor it. 4-point cortisol, we're checking it to see how your cortisol level is. So the cortisol has to go up during the day and then go down slowly and get us prepared to go to sleep, like a sun up, sun down. But sometimes as our body is so much under stress, it's caused cortisol to release too much, stay up. So at night is picking up. That is telling me the patient can't sleep throughout the night. And we need to work on that nighttime to lower the cortisol by deep breathing, meditation, lowering the light, and making sure they are not on their phone, making sure they are not watching the news and being under stress. And then at the same time, sometimes too much of the cortisol release causes inflammation and tissue destruction. So body is lowering the cortisol, and then they feel tired the whole day. And sometimes their cortisol tanks at 2 or 3 p.m., which they are craving for that sugar and coffee. And that way, when we test for 4 times cortisol throughout the day, we're going to find out about that and see how their body is adjusting itself with the stress. Checking for the thyroid, as we said, checking for fasting insulin, HOMO-IR, and homeostasis is how our detox and metabolism works, and if we need to support with B vitamins. HSCRP is another test we run for finding out the inflammation, mostly cardiovascular inflammations. TNF and IL-6 are the inflammatory process again. And then we're checking for 24 hours blood sugar monitoring. For example, I was waking up with headache and I didn't know why this is happening. But when I did the 24 hours blood sugar monitoring, I found that my blood sugar drops around 3-4 o'clock a.m. And then I wake up with a headache in the morning. So I start having more protein-rich food at night, such as peanut butter and celery and cucumber and things. And then my sugar was more stable throughout the night, and I wasn't waking up with headache. So it's really important to find out what is causing the hypoglycemia, lowering blood sugar, or high blood sugar. Sometimes it depends on the body. If you eat bread or rice, it depends on your body. One of them is raising your blood sugar or 2 of them, and you can find out by checking your 24 hours blood sugar monitoring. Functional medicine lab will be like we're testing for stool testing, as I said. Sometimes GI map, sometimes Geneva 3 days GI effect, organic acid testing, and also Dutch testing is hormone testing. We're looking into the detox pathway of the hormone, how our body is getting rid of extra estrogen, and do we have enough progesterone, testosterone, our diurnal cortisol level, and also checking for melatonin, neurotransmitters, our gut health. So it's pretty comprehensive hormone testing, and it's through saliva and urine. We check for nucleovalve and Geneva metabolisms, which is checking for micro biome and also for detox pathway and also nutrient deficiencies, and see what food we eat more. That way we can balance our nutrients. And also we talked about the cortisol testing. The 5 pillar of integrative protocol will be first, optimizing metabolism. Optimizing metabolism is optimizing hormones, make sure we detox, our gut health is healthy, make sure we exercise, weight-bearing exercise, make sure we balance our sugar and insulin, and all of this is through the metabolisms, and we need to look into it. The other thing is balance of the hormones that we talked about, progesterone, estrogen, DHEA, cortisol, insulin, all of it. Lean body mass, make sure we do weight-bearing resistance exercise to not lose the muscle mass, because we need it when we become older, and that is protecting us. That is helping us to not get sick. And heal our gut again, and detox, making sure our body is clean, our environment is clean. Don't sip on plastic water, bottle of water, which is plastic. Don't go get your coffee in a paper cup, which is covered with the plastic, and you're sipping constantly on this plastic. Your deodorant could have plastic in it, or could have toxins in it, which you applying after shower when your body is warm and your skins are open, pores are open, and then you're putting that deodorant, which is toxic, to your lymph nodes under your armpit, get observed. And then we're coming into the thinking like, why we have a lot of breast cancers? So think about it. Our body is inflamed, it's not malnourished, hormones are not balanced, and now we're applying toxins into the lymph node, right? We're putting creams on our face and neck. Neck is full of lymph nodes also. And those are all toxins getting to our body. And we need to be cautious about what are we doing, because those are all causing harm, and we need to be cautious. Rest and sleep is really, really important, and stress management. So I'm going back to stress management, yoga, meditation, deep breathing. Breathing is important to making sure you breathe out for 4, breathe in for 6, breathe in for 4, hold for 6, and breathe out for 8. So those are the seconds. It is really important you breathe out completely. That way your lung gets open, your lungs open up, and you get a better air in. And also it's that oxygen saturation, and concentrating on your breathing, it will lower your stress. Also with the meditation and things, you're coming to present. At present, everything is fine. So what cancer taught me is like, I take day by day, second by second, and I enjoy it, and I do my best. And if I don't get tomorrow, I don't get tomorrow. But at least today, I'm going to live my life, not to be worried about tomorrow, not to be worried about and anxious about past. I'm living today. So it's really important that every time you feel anxious, you come to present. And at present, you have a healthy family, you have a healthy life, you are working, you're doing your best. You're here, and earth is moving, cloud is there or not, sun is out there, and you just enjoy your life. So that is really important. Some calming agent like ashwagandha, rhodiola, you can take to lower the cortisol level, help your adrenal gland. And then sleep hygiene optimization is really important. So 45-year-old female, weight gain, perimenopausal means progesterone, and progesterone is low, estrogen is stayed up, and then stress eating, because of that high insulin, high cortisol, and then low estrogen, and then insulin resistance. So we did the intermediate fasting. Intermediate fasting is important for women if they get a period or not, when they need to do that. And then taking the ashwagandha, which is for adrenal health and resistance training. And then she felt better. Male age 52, abdominal obesity, mostly CEO of the company, very high stress, and because not having time to exercise per him, muscle loss. Lab shows low testosterone. The sarcopenia is muscle loss, thyroid imbalance. So we balance the thyroid and replace the testosterone and ask him to do HIIT exercise at least 15 minutes a day. And then we put him on adrenal gland support. So at the end, after 90 days, which my program is mostly 3 months or 6 months, it depends on what do they need, because it takes time for body to heal and we adjust all of it. It's not a quick fix. Now I have so much support to give to the body to heal better and faster, but it's still that body's been under stress and destruction for so long. And now it takes time to heal, and we wanted to make it permanent. So it takes 3 to 6 months at least to heal the body. So it's better to do the 6 months program. So it's losing 5% of visceral fat and also improve energy and sleep, and balancing the lab will be really important. And then why it matters to do things early is because we want to protect the body and making sure it doesn't cause the destruction for so long, because it can, for so long, if your tissue get destroyed, such as thyroid, adrenal gland, pancreas, your gut, your brain, it's harder to replace it, and the age is going to be our limiting factor. So we wanted to making sure to start early, and we wanted to make sure learn it and teach our children too. That way they stay healthy and not deal with chronic disease. So my mission is to prevent chronic disease such as cancer, dementia, diabetes, cardiovascular disease. And with all of this, we can help the body to stay healthy and younger, longer. And then, so this is kind of what is my mission. And we have a novel medication. I've been asked so many times about GLP-1, such as Ozempic, tirzepatide, Mounjaro. Are they good, not good? So they are good. They work. But it's important that we give education to the patient. They just don't go and take that medication and don't eat healthy, don't eat enough protein, don't drink water, don't exercise, don't have a regular bowel movement. And here yet, they're losing weight. And that weight comes from fat loss. Toxic get released through their body, and then they don't have a regular bowel movement, they don't drink enough water, they don't exercise to sweat, so toxic doesn't have anywhere to get out, and then all of this causes the problem. So we need to educate our patients when we put them on those medications, making sure you get 30 grams of protein with each meal 3 times a day. You drink enough water, you replace your electrolyte by eating vegetables. And also you go exercise and sweat. You take a sauna, do everything you can do that, because that fat gets released. A lot of toxins have been accumulated in it and they get released. And now you have to get rid of them to lower the inflammation. And when you have enough of the proteins and collagen and nutrients and the correct multivitamins for your body, what you need, then you're supporting your body to heal itself, to get rid of the fat and toxins, and don't lose hair, don't feel tired, and don't lose the skin elasticity. All of this is important to consider. LDN is another one that I like, is low dose naltrexone. I use for my patient to lowering inflammation, helping with the craving, and also helping with the sleep, lowering stress. The other thing, some of the peptides such as testosterone has been approved, FDA approved for HIV visceral fat loss. So we want to help them. But and also their growth hormones. So they help with our hormone metabolisms better. MOTS is CJC or SS31 or some of those peptides are helping with mitochondrial health, energy production, metabolism health. But all of this needs to be under supervision of the provider, because if you fix one thing, the other thing is not working. So our cells, they have receptors, and peptides such as insulin, GLP-1, or those peptides, they are signaling molecules. So they're signaling to the cells, and those receptors, they have to be healthy to respond. If we don't have a healthy cells and the receptors are broken, then this signaling molecule, they do so much. That's why we come up with the weight loss resistance. So we have patients on GLP-1, but they stop losing weight. We increase the dose, we increase the dose, we increase the dose. But if the cell is not healthy, how much can the medication do? Really nothing. So we need to help it. We need to help the cells to become healthy, to uptake all this that we are giving and function better. So in summary, fat gain post-body is hormonal, metabolic imbalance, and is inflammatory. And we can use functional lab, we can use integrative medicine, we can use conventional medicine, all of it together to heal the body and help it to get better. It's not a quick fix, but it can happen. And we don't want the one to become, and we know like how cancer, dementia, and cardiovascular disease, diabetes, and things are prevalent, and we don't want that for everybody and our children. So we wanted to make sure we learn how to, with our genetic testing, how to prevent all of this and help our body to stay healthy and happy. For example, I didn't know about I said, like, I didn't know about my fat cells, that they don't let me to exercise every day and go to camp. And they were developing inflammation around themselves to protect itself. When I did the genetic testing, I found out about this. So what I do, I eat before, that way I wrap up my metabolisms during exercise, and I take a break between my exercise. That way I let my body do its work and what genetically is right for me. So it is really important to do that for us and find out. So still, if you have any questions, if I shine the light on something, but some other things, the question comes up, feel free to schedule a 15 minutes appointment by scheduling the first barcode and the QR code, and then you can visit our website also by scanning the second QR code. So thank you for being here. I'm going to stop sharing my computer and my slides, and I'm going to stop recording, and then we're going to go over all the questions and answers.